We're here in the Capitol with some illustrious past members of our chamber. Obviously, current member T.R. Rowe representing Trumbull, Ms. Morag Vance, who was a past representative and a longtime first selectman of Trumbull. And we have Elinor Wilber, who was the past representative representing Fairfield, as well as Ms. Julia Bronder, who is a longtime advocate of Alzheimer's Respite programs. And this is the purpose of why we're here. We're here to begin a discussion to raise awareness on the importance of Alzheimer's Respite program, that the value that it has not only to the patient, which is suffering from Alzheimer's, but also the caregivers, and the importance and the value of all that. But I will defer to Elinor to begin the discussion in her perspective on the Alzheimer's Respite Care program.
Well, when I was in the legislature, my husband came down with, I guess that's how you have to say it, with Alzheimer's disease, and that's why I left the legislature and I became a full-time caregiver. It's the kind of caregiving which is, I think, unless people have been through it, they have no idea. But I had to lock my husband into the bedroom at night, for example, so he could pace and I could sleep. And of course, you don't get much sleep that way. So the respite care program is really a program to give a break to caregivers, in particular with people with dementia. That you could offer it, I suppose, for a lot of other problems too. And Julia and I, Julia also she'll tell you her story, but we went to Senator Gennario in Norwalk and asked him if he would sponsor a bill on the respite program, because we were very aware of how many people were out there, some having this really, really major problem, and many of them not eligible for any other program. And he immediately responded that he would support it, and I think then the more we looked at it, we went to Mark Ryan, who was then the officer of management and budget, and he said, well, it must save money, and took it to the governor, and that really was how the whole thing began. But its intention is to relieve the caregiver and thereby offer better home service to any patient of Alzheimer's or dementia.
Well, Maura, you mentioned that you chaired or served on the board of the Visiting Nurse Association. When we talk about respite care and that kind of care that's so important, what did you see the importance? Where do you see the importance of respite care?
It was a lifeline. People who assume the care of someone suffering from dementia or Alzheimer's, whatever you care to call it, become prisoners in their own home. They became 24/7 caregivers. If it's your spouse, you end up bathing them, you end up washing, you end up dressing them, you end up worrying that they're going to leave the house without your knowledge and not be found because they will wander. Respite care allows the person, the partner, the spouse, who assumes the care of their loved one to have a little bit of a break so that they can breathe, they can have a little relaxation, and they can get away from the terrible, terrible burden that they've accepted. And most of them will not give up that responsibility. And if they won't give it up, then the best we can do is to help them by allowing them to have some time to themselves. Very important.
Well, I think as we learned through Appropriations Committee and through Elinor and Julia, that the incidence of health failures for caregivers are extraordinarily high. Do you know the particular numbers and share some experiences?
Of the
caregivers and the pressure and the difficulty that you confront?
Well, my husband was an engineer, and I was teaching at a local university when he came down with dementia, which turned out to be Lewy bodies, which we didn't find out then. But he went downhill extremely quickly. He was fired from two jobs consecutively when he had 3 degrees and was extremely well qualified, but he came to me one time and he said, I can't remember what I'm supposed to do. And I knew that by the December of 1991 he was not going to be able to carry on any longer, and he was indeed fired just after the Christmas party. It took me nearly 4 months to get him diagnosed, and then after the diagnosis he went down. Within 18 months he could not feed himself, he was incontinent, and he could not speak much anymore. Well, I had to give up my job too, so there were 2 full-time incomes, and I'm getting to the point of the respite care program. The 2 full-time incomes disappeared, and since we were both way under 65, there was no program, town, state or federal, to help us financially. And I could not get away, and it was a desperate situation, and I had 3 kids in college at the time, and I had monstrous fees to pay. I had 1 child in New Zealand, and I had 1 out in a doctoral program on the West Coast and 1 up in Ithaca. And suddenly, no income and no health insurance because the COBRA ran out. And I thought, what am I going to do? And at that time, I approached the Alzheimer's Association, and finally I became involved in public policy. And in my 5th year chairing the Public Policy Committee, our group, including Elinor, got this program together, and miracle of miracle, with a lot of hard work, we got the program passed. Now the idea is, if you get so desperate that you are at the end of your rope, emotionally, physically and psychologically, with caregiving, you are inclined to put your loved one in a nursing home much earlier. Now, at the time, my husband, he finally had to go into a nursing home, but had there been a respite care program available to me at the time, I might have kept him out a few months longer. Now, the amount that a person currently gets for respite care from the state program is up to $3,500 a year. That's less than the cost of 1 month in a nursing home.
And less.
Much less. Much less. In fact, it's almost half for a year of respite care from this program. You are about 2 weeks of a nursing home cost. So obviously it saves money to the state. And it's a very cost-effective.
Well, I think that is a very key point in this day and age where we're confronted with such fiscal constraint. And what really led me to be more aware of this issue was a year and a half ago, Elinor gave me a call and educated me about the value and the importance and the economic benefits of the respite program, in the sense that you are spending good money to save more money. And it is this reason why you're up here in the Capitol, and we were able to save the funds last year from the governor's cut, and in no small part due to Representative Rowe and his efforts and his commitment to understanding the importance of the respite program. How did you learn about it, and what are your thoughts on it,
well,
Representative Rowe?
Thank you, Representative Morag. And it is neat to be here with so much institutional knowledge. But it's an issue that, it often isn't at the front of our policy debate here. But one would be hard-pressed to find a single program that does so much good for the relative small investment that the state makes in it. And if ever there was a penny-wise and pound-foolish proposal, it would be to cut the respite program. You hear a lot about trying not to shred the safety net. And what is government's core function? Well, government's core function is to take care of those that can't take care of themselves. And I think that the recent past has grown that safety net unnecessarily. There are people who can take care of themselves, but don't, and therefore it's fallen upon the government. These are people who, through no fault of their own, cannot. And not just the victims aren't just those that suffer from it directly. It's the families, as we've discussed. And if in a $20 billion annual budget we can't find the money to properly fund it, then why the heck are we here? And it's very frustrating that this seems to often be an area where we think we can nickel and dime. And we ought to stop trying to extract the nickels and the dimes, be serious about helping these people who truly form, they're in the middle of the safety net. And we can't abandon them, and I don't think we will. Certainly we won't. I'm hopeful that the governor and the legislature in general will pay the attention and give the respect and, frankly, the monies that are due this problem.
And for me, it's important to have this video, to be able to share with a broader audience, for this simple reason. The unsung heroes are you and you, who are the caregivers, who give, as Morag put very eloquently, because they want to. And at times they're at wit's end. And I think it was Elinor who shared with me, why don't you have more presence up here, I asked. And Elinor said, because we are far too busy caring for our loved ones. We can't take a day to come up and testify and advocate like you have just done today. And it is incumbent on us to share that with people, to make them aware. And you're too exhausted. I think the way you educated me was not simply through words. Because for you to say that you were tired, that would be a daunting task. And you were. You said, I'm just too tired to come up to testify for something that is so important. And that is the reason why we're here to advocate. And truly, you are all the unsung hero. And our hope is there's so many other out there that can't speak.
The first year that we brought this bill in, we had a woman who testified who had been out of her house 3 times in the last 2 years. Twice for eye surgery and once to come here and testify.
And she
was taking care of her husband. She was legally blind.
3 times out of the house for the whole year.
For 2 years.
2 years.
Yeah. And twice for eye surgery and once to testify here. She felt so strongly about respite care. I mean, isn't it amazing?
And the other point is...
But the victim of Alzheimer's or dementia can't testify unless it's in the very early stages. They're incapable of doing that. So when you have volunteers to come and talk about a lot of things, they're the people who are actually dealing with it. But with Alzheimer's, they're not the people. They're usually the families that come.
I was just lucky to be young enough at the time that I could once... by the way, my husband did go into a nursing home and had to go on to Title 19, which meant all my assets had to be spent down. And I can only say it was an extremely tough time. But Title 19 costs the state a tremendous amount of money, whereas the respite care program is such a small sum in the total budget. So we would like it to be much more money than it is, but we were very happy that we got that amount through.
Now, for people who want to get more information, where can they reach out to and how can they get this information online?
The best place to talk to and telephone is your local AAA. There are 3 area agencies on aging, there are 5 in the state. They represent, they're in certain districts, and they are the ones who manage that money for respite care. And when you need that kind of help, they are very definitely the place to call.
AAA?
The AAA, area agency.
Not the car.
Not the roadside assistance.
Okay, because that's kind of important, right?
Well, yeah, but it is.
So it's the
Area Agency on Aging. And they're in the phone book, and they're the ones who handle the money, distribute it. They also have some other resources for other problems, and for say they will often understand where transportation can be got to go for kidney dialysis or that kind of thing as well. So they are very
Home health aides.
the home health aides. They know a lot of things that can be done but you have to get in touch with them,
And
or
the-
you know, that's it. You
The
really-
general, and another general number would be the
Alzheimer's
Association in Rocky Hill. Will be very helpful. They have a helpline. If people are desperate, they can call and be put in touch with the right program or help or just advice that they need. They have a lot of brochures and legal help. They have, will tell you, that's one of the important things to get in place. If you have someone with dementia, especially if it's your spouse, to get your finances in order. The Alzheimer's Association will help you with the legal problems involved with the disease.
And even, I think, give you advice about which doctors deal particularly with the disease. Psychologists, psychiatrists, and medical doctors, all of them probably need to be involved in the care of the patient.
And the area agency is also capable of doing assessments.
Yes.
They will come into a home and assess the needs in the home and help tell people where they can get these services. And in many times, they're able to recommend or provide services to assist people in the home.
I'm noticing that daycare centres are being defunded, but that was a big help for my husband in the early stages where he could still be with people. And they were just a tremendous help. And the Alzheimer's Association will direct you to a group that you can go to at the time of day that suits you, day or night, when you can get away. And they will give you a list of groups in your particular area of Connecticut.
Support groups.
Support groups, yes.